Good morning, everyone. It's so nice to see a full packed house of doctors and engineers, and some doctors who probably can be engineers. I don't think any engineer can be a doctor by the quality of presentation that I've seen from doctors versus engineers. So, big round of applause for all the doctors here who probably have years of experience ranging from 30 years to some of the fresh doctors I met backstage who have just passed last week. So thank you everyone for arranging this and inviting us. I think the topic I had is a generic one, which fortunately has been covered in a lot more details earlier. So it was good to see those presentations. They've explained what is multimodal. So I would not spend too much time on the details of that, but I would try to give some of my perspectives around that and what Microsoft is doing. Microsoft in general is really investing on building the platforms, in building the tools so that everyone can come together and build solutions, build diagnostics, build LLMs. So we'll go to the next one, which is really taking a shot at further explaining what is multimodal diagnostics. So I think healthcare doesn't really fail because people don't care, or some clinicians doesn't care. It's mostly struggles because the right information is fragmented, it arrives too late, or doesn't travel well across settings. It may work in a tertiary hospital, but may not work in a hospital where the patient needed emergency care and there was no data available. That is where multimodal infusion will really help all the clinicians. I'm not going to talk about all the data because that has been repeated in 3 sessions. So images, clinical text, labs, genomics, sensors, all kinds of data. And this is where the opportunity is for all the builders out there to create intelligent solutions utilizing this. I think a lot of us spoke about how clinicians will use it, how clinicians will make use of multimodal diagnostics for their betterment, for making the right decisions, for detecting certain cases earlier, for detecting some pretty threatening diseases earlier in life cycle. What I also want to talk about is from a patient perspective. I think this is where multimodal diagnostic has the biggest advantage. And I talk about it as we move from the last session. I think we're moving more from a data angle to more emotional angle as we thank Dr. Chinnababu. I want to talk about a personal experience where my dad was identified with a cancer, and we went to the best hospitals, we had all the diagnosis done, and we were given the options. At that point, being an individual who believed that I'm very good in technology, I did all that a normal human being would do, and I searched and I Googled and I Binged and I did everything that was available, but it just led to more confusion. I had no credible, trusted way to say whether the steps that have been told to me are the right ones. And that is because I was looking at it in isolation. I was looking at what was the prescription given and what was the symptoms at that particular time. If I had a tool which could give me a trustworthy information at that point, which will combine not just that point in time data, not just that particular clinical text that was given, not just that particular test, but look at the entire thing, probably, and I'm just saying probably because it was not a great experience after that, probably I could have taken some better decision. So that is where I think multimodal diagnostic is not just limited to clinicians making better decisions or making faster detection, but also the patients, the family of patients, the near and dear ones of patient using that data either in time of emergency when there is nothing available, if all that historical data is there, or in terms of critical care, in terms of taking decisions which could have a big impact not just on you but on entire family. So just wanted to make that point because I feel this AI help is global. It is a phenomena, and it is not limited to only the patients, only the doctors that will reap the benefits, but it will be across the board. I will move on to the next point. Again, just 3 proofs I think again have been talked a lot about, but eye care, I think it's such a direct implementation of using multiple data points, using retinal images, using HbA1c medication, plus certain historical data. It really leads to early identification. I have some examples later on which highlights those examples where it has been used. Cardiology, I know enough doctors here who have been working on this. One of the areas where it has done immense progress already. We know how we can combine multiple data points and get a better prediction. I mean, if we can get better prediction, we can probably take better care and avoid some of the events that occur because of it. Cancer care, I think lots been talked about this as well. Some of the recent data that really points out immense progress made in this. Some of the research statistics really suggest that it can be a difference of more than a couple of years if all the data is identified, stored. Of course, there are a lot of challenges. Of course, we are at the birth of the upper curve that we are all witnessing in terms of AI progression. But even now, the empirical data, the statistical data is showing that the detection of such cases have started coming earlier. And in a certain region where these data are more centralized and are being available more easily, those early detection are saving up to 3 years in terms of identifying that early. So the advantages are coming for combining all the signals, not just looking at that single data source. Some data points, again, I think this will change drastically and they are changing. So lower administrative workload, I think they talked about in radiology, it applies at Microsoft recently signed a big contract with NHS, and one of the key focus there is how can we spare that 2 hours of a clinician's time so that they can serve that time on a better purpose. Now, this data is actually based on the statistics that's collected, but one of the convocation that I attended recently, all the fresh doctors coming out, they gave a thanks to the faculty. One of them mentioned that my biggest fear is my work-life balance. The person who is just coming out of college, he has so many dreams, but his biggest fear at that young age, and here's my son sitting right here, was work-life balance, that he will come in this profession. So I think these tools hopefully will change that, hopefully will create that better sense of work-life balance. There's more interaction time. We talked about breast cancer. There's so much more detail, so thank you for that. I'm not going to talk on that more. I do want to talk about this 5.2 years. That is the target, and that is there. And the earlier numbers that we collect, the statistical numbers we have, really pointing to a big improvement in that area. So cloud infrastructure. So I think we all understand working in silos. If the data is in silo, if it is in one hospital, it is not going to help. It is only going to help if we are able to have a scalable compute, and scale comes when we move to cloud. If we are able to really improve our interoperability between hospitals, between regions, between languages, between different data platforms that we have, only then we'll be able to reap the full benefits of interoperability. So I think this is something, it is essential, it is foundational, and I hope we start collaborating across different areas that we have. India's healthcare opportunity, I think we all agree to this one. We have a great gap in terms of access. If you go to from urban to rural, you'll realize how much that difference is. But fortunately, most of us do believe, 76% based on the statistics, that AI will help. 80% believe it can save lives, but the big number is 67%. That is where the bias and the need of guardrails is there. The trust is something that we need to build in, and that's what I really want to talk about. How do we build that trust? How do we create systems which do not generate more doubts, but gives us the pinpoint answer, gives us the reliability, gives us the trust to take that forward. Co-design, definitely, as I said, engineers can design some boxes and design some technologies, but it needs to be with clinicians, with patients to come up. Microsoft recently signed up last month with Mayo Clinic to build a large model. Mayo Clinic has been doing some tremendous work earlier, but this will be one of the pioneer work they will do with Microsoft to build a LLM that will help in creating trustworthy models. Continuous governance required to ensure that it does what it does within the governance of the legalities and the regulations of the geography. It needs to be explained, and I don't think this is limited to healthcare. Even in any forecasting solution that I've worked in past, or any scientific exploration that we have worked in past, unless it can be explained, unless it can showcase the entire trail, it will fall flat. So that's one of the key principles to ensure that the trust is built. And then finally, human oversight, human in loop, or I think Mr. Manoj talked about human controlling the loop, human on top of loop, whatever you call it, human is going to be the essential ingredient in ensuring that this is success. So without trust, no adoption, no scale, and we'll be reducing it to just machine learning rather than going beyond what we have. So some examples, I know in terms of time, I have a minute. So some examples about Microsoft. So 3 areas we talked about earlier. Forest Health really addressed this solution. So they went with Trinetra portable solution. They collaborated with Azure IoT Edge. And there is a big documentary on what they did to increase this visibility in rural India. A big success for AI, ensuring that it's reaching where it could not earlier. Apollo Healthcare has also partnership with Microsoft to ensure that the data or the heart risk score is built along with real life 400,000 patients that they had. And this really helped them kind of pinpoint 21 key factors that really put someone in high risk. SRL Diagnostics, another one on pathology. Again, pathology, I really loved the session earlier, so much more detail, but here is the example which utilize AI to ensure that they are able to scale further. I will skip this in the interest of time, but I just want to leave with a question. We all have the key takeaways from all the sessions today that we need foundational models. We understand that it's important to build those trustworthy systems. We need cloud to scale. And I think most importantly, India is the proving ground. We have the talent, we have the geography, we have the demand, we have the critical gap, and we have the technology hub. So I really want to ask everyone, what will it take to deliver trusted AI and enable? So please go to that, think through that, meet me around in the breaks. I would like to discuss and really enrich my knowledge further. Thank you very much for your time.
Thank you, Mr. Hitesh. Over to the chairpersons to coordinate the Q&A.
Hitesh, thank you very much for just skimming around the surface on that. But I just ask you, go back, leaving that, get down to Microsoft. Now your Azure, your other models, want everyone to have a company to use that. Not a subscriber cannot use any of these. So how are you democratizing your data, or are you commercializing your data specifically?
Yes. So I think what we are doing, one of the things that I talked about recently, there is a huge, there are 2 sides to it. One is the Copilot usage and the Teams and the SharePoints, which we know that have enterprise grade help to anyone. Now that enterprise can be NHS who have signed this large contract, or could be any hospital who have their data who they do not want to share outside, they want to utilize it for themselves. What Microsoft is also investing is in building the platform. So it has built the platform, it has built all the tools which can be used to, so we're not saying, okay, within Azure, only use this model, right? It is open for everything. We have clouds that are getting deployed on it. We have created a platform not limited to one particular technology that you need to be subscribed to. So that's the open part. There's a subscription part which is more related to for people who want to limit it within their within the firewalls of their organizations.